Hmm. Hey, how you doing? I was on here earlier, but I didn't make it public, so that's the reason why it's taking me so long. I'm like, why is nobody here? It's because I went private. Mr. Wallace, How are you doing? I'm good, actually. Actually doing okay. How are you doing? How's school and or work? Welcome everyone. If you don't mind just saying hi. Hi Destiny. Hi Miss Forth. How are you? Thank you. Thank you so much. And we're yes, thank you. Nurse Ultron. Thank you so much for joining me again tonight. Thank you so much. So tonight we are, of course, going to do our Q and A as we normally do. But tonight I actually had a someone ask me a question on TikTok about new grads doing travel nursing, like new grads in terms of they just graduated like 2 months ago doing travel nursing. And I just did a video on this, but it's like a big no. I don't know why anybody. You said work is a mess. What you mean? What do you mean it's a mess? But I don't know why anybody would want to. Yeah, it is a horrible idea. I don't know why anybody would want to do travel nursing as a new grad. And to be honest with you, because of what's going on with nurses leaving the bedside, yeah, I say that too. Get at least 2 years experience in your specialty area, and then when you can get out there, you're ready. And even then, you're probably not even ready. But at least you're better prepared because for some reason they think that somebody's gonna actually train you. There's no training when it comes to travel nursing. They give you maybe 3, 4 days of orientation, if that. You have to learn that computer system, charting system within a day or so. They don't give you. They expect you to come hit the ground running. So I always tell people, do not fall for the traps. They are baiting you. They are baiting you when they if a travel agency, a nurse travel agency is trying to recruit new grads. That is not a good agency. That means there's liability. Oh, 5 hours. Okay. Now that I didn't know. I guess it depends on the agency, but or the hospital. But yeah, I've seen anything between 2 to 4 days of training that they get, and it's just not a good idea for people to get out there. Even I question it, to be honest with you. You've been doing this for 17 years, and I question everything. Yep, that's exactly what it is, Mr. Wallace. That's exactly what it is that they care about everything but the patients and staff. Actually, I mentioned so on TikTok, I actually talked about that very thing today. I simply said on TikTok, I said, we up here thinking that many of us think that the actual managers and nurses and people care about us, the CNO, CEO, everything that you get in that orientation that y'all go to or that we go to when we first get a nursing job, all that orientation stuff is smoke. It ain't nothing to it. They're lying about everything, or they just don't remember what it's like to be on the floor. Because where are these people helping you when it's time when things hit the fan? And HR does not work for you. They work for the hospital. Just know that HR does not work for you. And so when I was telling today on TikTok, I was saying that we need to be mindful that we need to start making sure that we value our license and not value the hospital more than our license or whatever it happens to be. Because what ends up happening is you up here, you're working over your matrix, you're working short staffed, you're working, you're putting in all these hours, they're asking you to float to other units and you have no experience and they want you to float as a nurse, which is a no-no. They don't care about you or your license. They want a body. They want somebody to just I agree. CYA, exactly. That's our motto in nursing. So They don't care nothing about us. Okay. So the thing is, if you don't care about your nursing license, nobody will. Nobody will. So if it ever came down to your job or your license, you got to pick your license every single time. Do not be afraid to walk away from that job. And so many times we're so afraid, oh, I don't want to do this, I don't want to do that, I don't want to make anybody upset with me. You know what? If you live long enough, people gonna be mad at you anyway. If you live long enough, people will not like you anyway, and that's okay. So, hey, Mr. Pate, how you doing? I'm well. Thank you for joining me tonight, this afternoon. Thank you. We're just talking about basically that new grads should not be going to agency or travel agencies, getting travel assignments. New grads should not be doing that. We're also talking about the importance of maintaining your license and um, not worrying about the job, so to speak. So there's so many hospitals. Yeah, they sure do. Someone, can you come in early or stay late? Can you stay another 4 hours? They'll sit there and have you work a 16-hour shift, knowing good and well you got to come back the next morning or the next shift or whatever happens to be next night. They will do that to you. They do not care. They do not care. There was a time where we had a coworker who was going to a funeral and she was off for the funeral. She was actually off that day anyway, but it was the funeral of somebody in her family, and they asked her could she come in for the funeral. I mean, come in during the day of the funeral. She said, "Well, I have to go to the funeral." And she said, "Well, you can come in and leave early in time for the funeral, then come back after the funeral's over." I'm like, if that person not going to that funeral they need to go to, that hospital is still running before they got there, and it'll be running when you leave. So don't even worry about it. But they don't care nothing about you. They want to run you to the ground, and after they run you to the ground, then they will sit there and find somebody else to replace you, and that's all it is to it. It's just a business about getting money. No problem, Mr. Pate. No problem at all. So yeah, we're just talking about just the importance of making sure that you all be mindful that your license is more important than the job. You can get fired today and get a new job next week, literally, maybe even tomorrow. You can get a new job across the street. There's always hospitals and hiring. If that one is hiring, another one is hiring. It is. It does feel like a burnout constantly. You're exactly right, and that's the reason why I'm up here trying to really push and advocate for people to do self care and to think about themselves when it comes to how they're going to take care of themselves and their families. Because when it comes down to it, we literally had a nurse. This is probably maybe about 10 years ago now, who she ended up passing away. Like she worked half a shift and then she passed away like that night at home. And the very next day, um, they I guess they sent the condolences, but then the very next day they end up just putting her position, posting her position, and that was that. They don't care. There's like, oh, sorry, for your loss to the family, and they send the flowers they're gonna send, the little card they're gonna send, and after that, it keep moving just like that. So, you have to value your job, value your license, not your job. Value your license and make sure you protect the cost. I always say my license is my fifth child. I have four children. My license is number five. I don't play about my license. And so if someone says, well, you can do this or you can walk, but that's what I'm gonna do. I'm gonna walk. I'm gonna walk away with my license. And y'all can go ahead and keep this job. And when it burn, if you go down in flames, just go down in flames. I'm not gonna be a part of it. I say get so just and disrespectful. Oh, I know. That's why I'm to traveling. You got to have some thick, thick skin because the travelers get mistreated when they go to other to facilities. A lot of times, not always, but a lot of times they get mistreated because what ends up happening to the travelers is they end up taking the spots of the full time staff, and the full time staff is kind of like, well, we work full time, and yet they taking our spots. And if somebody gets down staffed or whatever y'all call it, is usually the full time person because they've already paid the travelers to be there thousands of dollars, but they won't pay yet to get more employees to stay. They won't pay to correct the problems that they have in the hospital, so they don't have to pay for travelers. They won't do that. They'll just pay the money for travelers. That's what they'll do. You see, tell you my phone nurses all this. Yep, yep. Before your obituary, you are never lied. They will always post that, and the next thing you know, you're gonna like, okay, you know what? Whatever happened to such and such? Oh, they died. They died, in this place right here, and meet Sarah, the new nurse who's taking her spot, type of thing. That's exactly what they do. Oh my gosh, I don't forget 7:30 in the meeting home. Kept calling her. She was in her car, had a stroke in her. Oh my gosh. Oh my goodness. Now that's terrible. So he came looking for his wife, and she was in the hospital parking lot. Yeah, okay, I see that. Yep, hospital parking lot. Thought, yeah, and that's what I'm saying. And then that that nursing is so stressful. It is so stressful, and you have people turn into drugs, people turn into um alcohol or both, and then we can't get any help. And the ANA and American Nursing, I'm sure it did. That's why I said not for me. Not me. Y'all can have this job. It's not that serious to me. So what I think on the mandatory vaccine. So this is I was asked that on TikTok too, and I honestly feel like we're going to come to a point where it's going to be required of everybody. And let me explain to you why. Whether you're for or against, or whether you got your vaccine or not, I'm not here to dispute that. And whatever your choice is your choice. But when it comes to this vaccine, I will say that um, I feel that no matter what, we are going to be required at some point, especially as nurses, at some point to take this vaccine. And the reason being is because if you think about it, let's just say you are taking care of patients, and a patient becomes sick, and they have COVID, they get COVID, and it's because of you, and it's because you were not vaccinated. They are going to come back and not only pursue you, they're going to pursue the hospital as well, and you're liable. Hospital don't want that kind of press, and they don't want that kind of liability. From a business standpoint, that makes sense. So I teach full time. So let's say, for instance, I teach, and my students don't get vaccinated, and we go to a hospital, and let's say one of my students pass on this virus to someone in the hospital, and guess what happens? The same thing happens. That family, if they die, that family could come back and sue not only the hospital but sue the school of nursing and the students, because of the fact that they were not vaccinated. So I don't per se, agree with the notion of everybody being forced to do something they don't want to do. But I do feel like what's going to happen is you either going to get the vaccine and keep it moving, or you're going to just keep it moving because you're not going to finish nursing school and you're not going to work that job. There are several schools, at least where I live at, who have said that if you either, like, literally, I have students as we speak that they are supposed to graduate in December, I think. And if they don't, they graduate in December, and if they don't get this vaccine by, I want to say August something, they're out the program. So they have to make a decision whether they're going to stay in the program, or whether they're going to go ahead and drop the program, or what they're going to do. And that's a very hard decision to make, considering you're about to graduate in December and you put all this money into it. And for whatever reason, these students do not want the vaccine. I cannot, it's not my job to sway them one way or the other, but I understand if you don't want it, and you feel like a lot of them feel like they don't want it because of the fact that not enough research has been done about the long-term effects. We don't know the long-term effects yet. And keep in mind, it'll be a year, I think November or December. It'll only be a year, November or December, maybe October, that the first vaccine was actually administered. So we don't even have a year of data yet to say what the long-term effects are, if there are any. And as you know, with any medication, there are side effects of medications. There's not one medication you can't think of, even a colace. A colace has a side effect. So if a colace has a side effect, everything else has side effects too. So we just don't know what they are yet. And I think that's why some people are skeptical. At least the students that I have are skeptical because they don't even know what the outcome could be. So I just think we're at a point now where we're going to have to make a decision. Some of us going to make a decision. Do I want to get this? Do I want to keep my job? Do I want to stay in nursing? Do I want to stay in nursing school, or do I want to get out? And and then that's that. And then I'm honestly afraid that it's not just going to be a nursing thing. I'm afraid there's not going to be a nursing thing in the hospital setting. It's going to be all the staff in the hospital, because how do you think what's going to happen is they're going to tie it to reimbursement, like Medicare reimbursement. They're going to tie it to that, and so when the hospitals tie it to that, they're going to say, okay, well, this is how we get reimbursed. So we need to have all our nurses or whoever to be vaccinated so we can get reimbursed. So that's what they're going to tie it to. And then what ends up happening is you have to either make the decision whether you. So then politics gets involved. Now we haven't got politics in here because of the fact that it's tied to reimbursement. Reimbursement ain't nothing but money. Okay. Everything comes back down to money. Everything we do in healthcare has to do with money first. So that's just kind of what I think about it. I think we're going to have to kind of govern ourselves accordingly to what we want to do. What objections do you have to the vaccine? Is it are you feel like you're forced to? And if you are, you have a decision to make. Should I quit nursing? Should I quit nursing school? If that's your situation, I don't know. I don't know what it's going to be like. The same turnover is so high. Expectation are so. Yeah, I can see that, and especially in a LTC facility, that the turnover is high, and as LPNs have to LPNs, is one who runs the show, and that when the DON and the ADON are the ones who are usually the administration and stuff like that. And then you have your CNAs, and they come a dime a dozen. But the thing is, they don't stay long because of the unrealistic expectations. And we're about to keep in mind, this is what, July, almost August. We're headed right back into another winter season, and you know what comes with that typically. So imagine what's going to come with that, in addition to this whole COVID situation, this Delta variant, and there's another variant called the Lambda or something like that variant that's out there. It just got to the U.S., but the thing is, we have all these other factors too, and it's going to cause issues with staffing and all. You think? Uh, that's proving dangerous. That I don't know, Mr. Pate. I don't honestly don't know about that. I'm not really into those kind of theories. I really do believe in terms of those of not getting, especially here in the South, where I live in Tennessee. We rank number. I just looked it up yesterday. Tennessee is number 44. We are 44 in terms of. I think it was 44. Hold on, let me look again. We are 44 in terms of fully. Let me find it. Okay, here we go. So the number one state. Hold on. The number one state, according to the CDC, of the people who've been fully vaccinated is Vermont. 67% of their population has been fully vaccinated. So Vermont is number one with 67%. They don't even have 75% in Vermont. And then where I live in Tennessee, hold on, we're number 44. Like I said, we're number 44 with only 38%, 38.9. So roughly 39% of our population has been vaccinated, fully vaccinated now, fully, not just the one shot. The worst state is Alabama, which is below us in Tennessee. It's 34%. So to speak to what you're saying, a lot of these states that are not that are on the lower end are all in the South. Louisiana, Arkansas. Arkansas is not really South, but Mississippi, Alabama, Tennessee, Georgia. All these states right here in the South. And I will say this about the South: the South has a larger percentage of marginalized as well as ethnic minorities here in the South. So when you have ethnic minorities, and if you all understand or know, Mr. Pate, if you know about the Tuskegee experiment, if you know about that Tuskegee experiment, you can understand as to why some of the minorities here are very skeptical of getting this vaccine. And they cannot be convinced otherwise. These people, the people who are part of the Tuskegee experiment, sorry, they at this point are either deceased, elderly, or their grandchildren know about this situation. And so your elders are like, no, I'm not getting that. I'm not going to be experimented on. And honestly, to a lot of people, I mean, I'm speaking my thoughts. This is not research, okay? Because I'm like, this is not research based. This is not research. These are my thoughts. A lot of people do not want to be experimented on. A lot of people feel that we don't have enough information out here regarding this vaccine and the outcomes, the long term effects. Now, has it been researched for a while? Yes, it has. They have been making this vaccine for over 10 years before this even came about. I can't argue that. What I can argue for the ones as to why they don't believe in it, I can argue that we don't have the data to support the long-term effects. Again, we just gave the vaccine just last year. So we don't have the studies, the longitudinal studies to say, okay, over the past 10, 15 years, this is what we have seen. So if you want to take a regular vaccine like Tdap and MMR and things like that, we have data that goes back for years, decades even, that states what the efficiency of that vaccine is, what the side effects are, things like that. We don't have that yet for this vaccine because it just got rolled out. And then keep in mind, we only had one or two to begin with. We've had a few more, like the Johnson & Johnson has rolled out in less than a year. So less than a year ago. So I'm saying all that to say some people are just not trusting, research yet or the science yet. Like show me first what the outcomes are going to be. Show me not to sound silly or nothing like that, but show me, you know, um show me, I guess, what are we going to have ears growing off the top of our head or something like that because of the fact of this vaccine? We don't know anything like that. And then you're going to have your other people who are going to tell you, well, think about the fact of, it's playing with numbers. I've heard that too. It's playing with numbers. Think about that. Well, the percentage of you chance of you dying without the vaccine is this, or dying of COVID is this versus that. So I think we just have to weigh our options. But I do think a lot of people here in the South, especially, um, are not proponents because of our history. And it's going to take a lot more than just, it's going to take a lot more than just some everybody, so you need to get it, you need to get it, you need to get it to convince them. You have people right now. Now, keep in mind, just because you get the vaccine, and I'm not saying whether you should or should not get it, but just because you get the vaccine does not mean that you cannot contract and pass the virus to somebody else. It just, as with any vaccine, what it does is lessens the effect of what it would do to you, so that you would have milder symptoms, is what they're saying. So you can still get the virus, you can still pass it to somebody else, even with the vaccine. So I don't know what people are going to do. You said when juveniles. Oh, is that what they did? The way to get to black people is a rap song. Yeah, you know what? That's what they do, though. They think to get to any of us. Think about this, and I'm not going to get into politics, but think about this, Mr. Wallace. Do you remember when I don't know if he was running for president or he was already president, but do you remember when Trump was either president or already running, and he had Kanye? He had spoke with Kanye or whatever, and then they put him on the news. He had spoke with Steve Harvey. They put him on the news. People think the way to get to us people, us black people, is through entertainers. So rappers, he's a rapper. Steve Harvey was a comedian. Of course, he does game shows and things like that. But they think the way to get to us is through entertainment, as if some of us, like we that's the only thing we look at or listen to. Speak on a lot of people don't know about the Tuskegee. Okay, so let me get my details straight on that before I speak on it. Hold on, let me get my details straight. I can tell the story, but I want to tell exactly right. If anybody knows that story, hold on, let me speak on it. I want to give you accurate information. Tuskegee Syphilis Experiment. Okay, so I'm gonna give you the gist of it. Okay, the gist of the so basically the study of the untreated syphilis was basically referred to as the Tuskegee Syphilis Experiment. So it was the study of untreated syphilis in African American males. This was back in 1932. It was between 1932 and 1972 that the U.S. Public Health Services and the CDC, listen to this. This is why people don't want to do this. Okay, this video gets taken down. Y'all know why, because I done sit there and said some stuff. But anyway, the CDC. So 1932 and 1972. That's recently. That's like I was born in 78, so this is right before I was born. The U.S. Health and the CDC. The purpose of was this study was to observe the natural history of untreated syphilis. So they were using them to experiment on untreated syphilis. They were told they were receiving free health care from the federal government, and they were not. The public started the study in 1932 with Tuskegee University, which is a HBCU. They enrolled 600 impoverished African American sharecroppers from Macon County, Alabama. So if you think about someone who's impoverished, that basically means that they are uneducated. They are, these people work the farms and things like that. So be mindful of that. 399 had latent. 300 of the 399 of the 600 had latent syphilis, with a control group of 201 who were not infected. So as an incentive for participation, the men were promised free medical care, but were deceived by PHS, which is the Public Health Services, who never informed subjects of their diagnosis and disguised placebos, ineffective methods, and diagnostic procedures in treatment or as treatment. The men were told initially that the study was only going to last for 6 months, but it was extended for 40 years. After funding for the treatment was lost, the study was continued without informing the men that they would never be treated. None of the infected men was treated with penicillin, despite the fact that by 1947 the antibiotic was widely available and become the standard treatment for syphilis. So that's the gist of it. So for those, the rest of it, basically they was coerced into doing something, thinking they were going to get free health care, not knowing that they were experiments. And as a result of that whole situation, that's why the IRB board came about. So IRB board is what we have to go through when I went to go get my doctorate, and the IRB board is because of them and the Holocaust, I believe, the Jews. They, because of those two situations, as to why we have the IRB board to see if when I want to do an experiment, when I want to conduct research and do studies, we have to go through an IRB board now to see if it's safe for people to do, will it cause them any harm, things like that. That's what came about from that. So people who come from this time period. So now that we see the dates, 1932 to what did I just say? 1970 something. Hold on, let me look. Let me look again. 1930 something to 1970 something. Hold up. One more time. My phone is not acting right. Let me see. What did I just say? 1932 to, I said, to 1972. So that's, like I said, that's recently. Think about it. 19, I'm only, okay, so 1972. I'm only 43. I was born in 78. So you add 6 years to that. That's 40. That's only 49 years ago. That's recently. Okay. 49 years ago. So these people could very much be alive still today. These people are still alive today. Some of these people are alive today to tell you the stories. And if they're not alive, their grandparents are, or the great grands or parents are alive to talk about this situation right here. And so these people right here, especially in the South, they're very leery of things like that because they have been exposed. They know this story. They either know someone, they were a part of it, and they just don't trust the government because the CDC was a part of that. And who we have, again, who's a part of this situation right here? Who makes the decisions? Who just told us we need to get the mask back out? The CDC. So you can understand as to why in the South, especially, that they don't trust the government. Nobody trusts the government. And so that's part of why we are having these delayed numbers here, when it comes, not delayed, but low numbers here of the whole vaccine. So can I say, I mean, honestly, think about it. I'm not saying it's right or wrong, but if you lived during the Tuskegee experiment or know of that situation, do you think you're gonna sign up for something that looks like the exact same thing that you just went through, or that your parents just went through? So that's kind of what That's kind of why I feel like in the South, especially, while they're not doing it here. We're not black if we don't vote. You know what? There's problems everywhere in the politics, especially. This is my first time watching. Oh, hey, how are you doing? CNB 124. First time watching. Oh yes. Well, thank you for joining us. I am very woke, and I'm gonna say it like it is. That's why I said this get taken down. Y'all know why. And I really haven't said anything negative per se, but I am repeating facts. And when you start repeating facts, that's history, and especially our history, it's not well received. It's okay if it's everybody else's history, but if it's our history, it's not well received. So I'm going to be speaking the truth. He said, Bill Clinton apologized for it. Like I said, there's so much, negativity everywhere. Mr. Pate, you funny. You're funny. So, I mean, yeah, seriously though, that's the reason why I think we are definitely in the situation as to where we're in. I can't say I could blame those people for not wanting to be experimented on. They just assumed to die. Some of them just assumed to die than to be used as an experiment. And I'm not saying that's good, bad, or indifferent. It is what it is for them. But I do feel that at some point in time, we will all be required as nurses, healthcare, to go get this vaccine, whether we want to do it, whether we do it or whether you get fired or whether, I don't know any provisions except for those who have compromised immune systems that will not allow them to get it. But even then, because you fall under a situation where, well, okay, well, if you can't get the vaccine, you can't work here. I do think that's the problem I see happening. So people who can't even get the vaccine, they can't opt out either. I find that they're going to probably, if they can't get the vaccine, they're not going to be able to work in that environment. I feel like that's what they're going to do. I could be wrong, but I feel like that's what they're going to do. I think eventually that's what's going to happen. So I could be wrong. We'll see. We'll see what happens over the next few months. And people are so you have your people who are vaccinated who are mad about having to put the mask back on. And many of them are saying, okay, I'm not wearing my mask again. I'm not putting that mask back on again. I'm not doing it. So what do we do about that situation? People refuse to wear masks. Um, I have no problem wearing mine. I go back to school. I start teaching on August 16th. And then they're telling us that, okay, well, the students who've gotten their vaccines, which the students ain't got no vaccines. But anyway, the students who got the vaccines don't have to wear masks. Okay, we're going to be sitting 40, 45 deep in a room. You think that I'm not going to have my students wear masks? Every last one of my students, vaccinated or not, going to wear masks, the entire class. Because, how do we know who got it and where it came from? So I'm like, my students, we wearing masks, and so am I. Our school provided us with N95s already. Got my N95, so I'm ready. Um, I understand waiting until it's mandatory to get it. There are the Delta variant and the Lambda. I think that's how you say it. Lambda, something like that. Lambda variant. The Lambda variant just got here to the U.S. But the Delta is the one that they say is worse than. I'm not well. Don't quote me. I'm not well versed on. I'm not following the data that that closely, but they say the Delta is worse than the original COVID. So be mindful of that. That in terms of how long it takes to even catch the virus is shorter than the previous one, and how deadly it is worse than the first one as well. So that's the reason why I'm like, okay. I would not be surprised if we kind of go back to a lockdown. I'm not saying it's happening. I'm just saying I wouldn't be surprised. I wouldn't be surprised if things start shutting down again. Masks are going to be mandatory, but we everything just opened back up again. Keep in mind the cruise ships have started sailing again. Theme parks are open. Concerts are going on. I'm going to a matter of fact. I'm going to a concert tonight. Tonight I'm going to see Eric Benet. But anyway, so, and we'll have our mask on. But yeah, I mean, everybody back to normal. You're gonna have a hard time, but besides closing everything down to bring people back in. Remember what it's like when all that toilet tissue was gone. We couldn't even buy toilet tissue. I feel like that's gonna happen again because people are gonna start getting scared and stuff like that. So I just feel like that's kind of how it's going to be at this point. That's what I think. Welcome anybody who's here new for the first time. Thank you for joining us. Um, joining me live tonight. I love doing this. I do this every single week, and we just simply talk about whatever usually relates to nursing, and just life in general. I could believe that. I could believe that. I could believe that, Nurse Ultron. That's exactly what's going on here too. Where there's this one guy, he was 17 and he got his first vaccine, and him and his mother, it was on the news or it was on TikTok, it was somewhere, and they went to a restaurant to eat or something like that, just like everybody else is doing. And he came down with COVID, and he is severely sick, severely sick. He already had one shot already. So, like, what's we gonna do? Yeah, that's very true. That's very true. Mr. Pate, that's very true. I don't know. It's kind of scary. It's really scary because we've lived through H1N1. We've lived through the swine flu. The one begins with a Z. I don't remember. It's one that begins with a Z. I forgot what it was called, but it was pretty recent in the past, say 3-4 years. It began with a Z. And if you came from another country, they would ask you to anyway. You couldn't. They want something. I forgot what it was called. It began with a Z though. We've lived through some. We've lived through some things, and we can't shake this one for some reason. We cannot shake this one. Now, some people argue Zika. That's it. That's it. Zika. That's what I was trying to say. Yep. We also, yep, you're right. That one too. So we live through a lot of these things, but the thing is, the coronavirus is nothing new. It's just what happened for it to, and it's kind of a rhetorical question, but what happened for it to be like this? This is nothing new. Because if you go look at your Lysol can, it says on there that it treats um, corona. So this is not a new phenomenon. This is not a new virus. Like, where did this come from? No, it's not new. The thing is, why is it rampant, or why was it rampant? What sparked it? And that was what people argue about, that it came from China and things like that. But honestly, I thought, when we first started this whole process, that within a month or two it'd be over. When we went locked down and came back up again, I said, okay, it's just going to be for a couple of months. No, we've been doing this for over a year and a half at this point. We're going on 2 years probably in the next couple of months. So, I don't know. I don't know what it's going to be like. So, yeah, Zika was the virus it was. That's right. So it's rough. It's really rough out here. So, what do y'all know what y'all plan to do? Do you think have you thought that far out yet to think that whether you're going to go ahead and get it when it's required, or do you think you may have to step away from nursing altogether, or I don't know if you're in school or not, that you may have to quit nursing school. Um, but I'm interested to know what other professions are going through this. So before you say I'm going to step away from nursing or step away from whatever altogether, I'm interested to know, are we the only ones because we're front line that's going to require it? What about your first responders, your fire, police, your EMS? They'll probably have to go the same thing we have to go through because they're always coming in contact with people, always. And then you think about your people who work at your stores, your grocery stores. They're probably gonna have to require it because they're always gonna have to come in contact. We always need stores open, no matter what happened. We had our stores still open. We still had Kroger's and Walmart and things like that. So I mean, I think that it's going to be not just a nursing thing. Like, what else are you going to do unless you work from home that you're not going to happen to have this vaccine? I don't know. I don't know. We have some decisions that we got to make. We have some decisions to make. So you got to think about what you're going to do. I did want to talk about a little history. If y'all know y'all's history when it comes to nursing in general, do y'all know who Margaret Sanger is? I'll put her name in the box. Do y'all know who Margaret Sanger is? Oops, her name is spelled like that. Sanger. Margaret Sanger. I think that's her name. Uh, you said you don't understand why I'm more. If you don't want to go through, well, it's gonna be a liability. That's why. Because wearing a mask doesn't prevent the spread of the virus, though. It minimizes it, but it doesn't prevent it. And like I said, it's going to come down to reimbursement. So because the hospitals have to be reimbursed, so if they can go back and say that we or clinics, if they can go back and say that we are 100% vaccinated, and these patients get this virus, they're going to be reimbursed because of the fact that they didn't acquire it from the staff. So I honestly feel like, that people are going to require it, and it's going to be because of reimbursement. So I don't know how the Mayo Clinic is funded, but if they're funded differently than um if they're funded differently than some of these other places, then that could be an issue. Margaret actually was a nurse. Margaret Sanger. Margaret Sanger, I think that's how you say her name. She's a nurse. She's the one who did Planned Parenthood. She is the founder of Planned Parenthood. And I'll tell you why I brought that up here in a minute. Do y'all know what Planned Parenthood is, right? We all know what Planned Parenthood is, where you go, and of course the negative connotation is you go for abortions. But Planned Parenthood is not just about abortions. They actually do, Planned Parenthood. If you are wanting to get pregnant, if you're wanting birth control options, they actually do all those things. So they do those things too. It's not just about abortions. But Margaret was a nurse, and she was a nurse who saw that, this is back in the day, but she saw that there was a lot of back alley abortions. And because there was a whole lot of back alley abortions, she wanted to come up with a way in which um, we Planned Parenthood, so that you, if you wanted an abortion, you wanted these types of things, you had in an environment that was clean, sterile. That way, it would not be increased resources. So that in itself sounds like is a good thing, right? Maybe. If you want to make sure that women are not out here just having these back alley abortions, and back in the day they were doing things like sticking those old wire hangers that people had, sticking wire hangers up in there, and causing themselves to abort. And of course your risk for infection, of course, it will go up and stuff like that. But anyway, that's not why I want to talk about her. Why I want to talk about her is because she put these Planned Parenthoods in strategic locations. Where do y'all think she put these Planned Parenthood's at? I'm gonna let y'all guess. Where do you think she strategically put Planned Parenthood's at? And I'll give you a hint. It's the same place you're gonna see your payday loan places. It's the same place you're gonna see your liquor stores. It's the same place you're gonna see your buy here, pay here's, your, stuff like that. Because keep in mind, even in your more affluent areas, they don't call them liquor stores. They call them what? They call them wine and spirits or something like that. In your more affluent areas, right? Exactly. In the lower income places, right? So she strategically placed these Planned Parenthoods in these places such as those because even though she did something that was supposed to be overall good, meaning good in terms of controlling um, these unwanted pregnancies and things like that, that in itself is okay. But she put them in the areas in which we're talking about because of the fact that, yes, Ms. Blackman, yes, that's exactly the right answer. It was intended to. She didn't want her. I'm not using her exact words, but basically, she did not want brown people. She didn't want brown people, black people, having more babies. She wanted to control the population for specifically black people. She didn't really say minorities, but black people. So that's something I want you to know. That's part of your history in terms of nursing, that and that same narrative plays out today in various things that we do. So when you see the government doing different things, it's no different than when we got our stimulus checks. So when they push for us to get our stimulus checks, there's always a hidden agenda as to what they do. So if it was strictly about Margaret saying, okay, we want to control the population and making sure we don't have unwed, not, oh, unwed was another issue. No unwed, she didn't want unwed babies or unwed parents. Sorry. Do you think black people are the only ones who are unwed and get pregnant? No, they're not. But that's exactly what happened. So that was her way of trying to control the population for black people by putting something good. Again, we don't want people having back alley abortions. So putting something good in a area that was populated with minorities to kind of control that population was what her goal was. So when I was just simply saying about the stimulus checks, if they wanted to do something good for the people to help open up the economy, we know that. But how many other bills did they slide through there to add to that agenda? So just that's kind of how the whole world kind of works. We will sit there and say, "Ooh, my nose is itching." Sorry, y'all. We will kind of say that, hey, we want to do something for a group of people. We want to do this. We want to do that. We want to do the other. But the truth of the matter is, what is your hidden agenda? And that is something that we really need to talk about. So when people want to give all these accolades to people, but what they did and what they haven't done, think about the things that they probably. What are they really trying to accomplish here? Is it really about you, or is it really about their bottom line? So Margaret was someone. If you don't know her, I mean, if you hadn't heard about her, look up Margaret Sanger and look up racism, Planned Parenthood and racism. So look that up. Um, and if anybody was here last week, I told you I went to go see the movie Old, 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 that came out. That is a good movie. That's something that y'all need to see. That's a movie recommendation. Y'all need to go see Old. I don't want to give it away, but I think people in healthcare could appreciate it and understand. I'm not saying it's a good or a bad movie. I'm just saying it's an aha moment. I'm like, oh, okay, okay. It makes you think about the government differently. So the movie Old, OLD, it just came out last Friday, I want to say. Go look at that movie if you get a chance. I think that's a good movie to kind of depict some things that's going on today. Nurse Ultron, what you agreeing with? You said exactly. What you agreeing with? My nose is itching. Mr. Wallace, that's 100%. Your aunt's 100% dead on. Everybody's intentions are not good. They're not good. Mm-mm. They're not. That's just the way our world is. And so, you have to be mindful that, are they trying to help me? Are they trying to oh yeah, there's always hidden agendas. Always. Even in your jobs. There's, when they sit there and say, we're going to um have you seen where they'll sit there and try to get rid of a certain group of, like, let's say for instance, if they're wanting to go magnet status, they're doing a great thing by going magnet status in the sense of they are trying to, get more government funding, go and get more grants, things like that. But at what cost? You're getting rid of your LPNs, you're getting rid of your 2-year RNs unless they're going back to school. You're getting rid of certain pockets of the population. Or talking about hidden agendas. What about these hospitals who go and get bought out by different companies? Our hospital went through that before. We got bought out by a different company. But the people are like, oh, this hospital is gonna be so much better because it's now under whatever, right? It's the same people who work there. It ain't the name of the hospital, it's the same people who work there. So that part don't even matter. And that's the part they don't understand. Lay people don't understand, shall I say. They're like, oh, that place just got bought out. Maybe we're gonna have a better this, that, and the other. It ain't no different. No different. If anything, it could be worse because this place could be for profit now. If it's for profit, then what? If your hospital's for profit, it's different than as one is not for profit. So anybody who working in nursing, um, it's okay. I'm gonna read that book. I appreciate that. Okay. Let me hold on. Let me write. Let me put that in my phone. I'm always loving book recommendations. It's called hold on, Killing the Black Body. Okay, I'm gonna actually put that. I'm reading another one right now, so I'm gonna add that to my list. Imposter Syndrome. Tell me what that means before I answer that question. Killing the Black Body. Sorry, I'm just gonna put it in my phone so I can book recommendation. All right, so I can watch that. Listen to that book. Start on these faith-based hospitals. Oh my gosh, yes, faith-based hospitals. We have plenty of them here. Some of the biggest crooks. Yep, you just said the same thing I was thinking. Some of the biggest crooks are in them hospitals. That's the same thing they say about religion too. And I don't know if anybody's a Christian. I am. So I'm talking about myself. I'm talking about my own religion. But some of the whole Christian component is we want to, or just for people in general, will sit there and criticize somebody else because their sin is different than our sins. So let's just say, for instance, we're talking about abortion, right? We're just talking about abortion. Me personally, I don't believe in abortion, right? So if I got pregnant, even again, which that don't need to happen, but if I did, I wouldn't abort the baby. I don't believe in that. But I'm sitting up here judging somebody else because they did, but I would done went and what did I do? Let's see, something I done. I went and had my first child out of wedlock, which is against the Bible too. That's a sin too, as you all know. So like, okay, so just because you're seeing differently than mine, don't mean So why I hate that sometimes we all pick and choose what sins we want to acknowledge and which ones we don't. Just because you sin differently than I do, then we got a problem with it. That's the problem I have with Christians. Some Christians anyway. So these faith-based hospitals are ran by people who don't even have that faith. Think about it. These faith-based hospitals are ran by people who don't even have that faith half the time. Yes, you're right. COVID did make it clear. Did you see that? Did you see that It was she's been deceased now for maybe 4 or 5, maybe 6 months. But the black doctor who had COVID and she died, she was a doctor. She was a physician. She was on the news. I forgot what her name was, but she was on the news. She died of COVID because they wouldn't listen to her. She even asked to be transferred to a different hospital. They wouldn't listen to her, and she was a physician. I don't know where she was from, but that was her. I don't know where she's from, but she was on the news. So yeah, this is kind of like if you want to know how sometimes minorities get treated, don't let you have a little status to you. Don't let you have, and most of us are only middle class anyway, so most of us don't have even what we need to have to consider to be elite at that. So yeah, COVID just made it clear. That's why I said that doctor right there. If the doctor, that physician, is getting poor treatment, that was my wake up call. That was my wake up call, Miss Blackman, when I saw that doctor get end up dying from it because she knew what she had, she knew what was wrong with her, and she couldn't get help. They wasn't listening to her. They wasn't, and that's a problem. So what about ones, which means she's knowledgeable, right? She was a physician. She's knowledgeable. What about the rest of us who are not? What about the rest of us who are, who are uneducated? Some of the people who I live around, who I take care of, who will believe whatever they say on the TV. Well, the CDC must says it, so it must be right. And I just told you about the syphilis thing was done by the CDC. Syphilis was done by the whole, I mean, Tuskegee thing was done by the CDC. They was partnered in it. So I mean, like I don't know who you can trust. Absolutely right. I always say, Miss Blackman, I learned. I'm embarrassed to say this, but I learned probably about 10 years ago. 10 years ago, I learned about that hospitals are business first, and probably healthcare is probably tertiary on their list. Like it ain't even the second agenda. Hospitals are money first. The people, those CEOs, COOs, all this stuff, they second, and healthcare maybe third or fourth. Oh, okay. Yeah, I know what that is. Okay, let me go back to your original question about that, though. What you say about it? Okay, how did I get beyond it? Um, for me, I know my worth. We have to. This is a great question. Hold on, let me put that in here too, because I'm gonna talk about that on TikTok. Thank you for that topic. Hold on, let me put that on my TikTok list to talk about. Imposter syndrome. So first, you have to acknowledge why we feel that way. Why do we feel that we don't belong someone? Why do we feel that we don't belong somewhere? Sorry, that we have every right to be because we have earned the title, the rights, the whatever to be whoever we are. Why do we feel that way? It's because we insecure. Part of that is true. We're insecure. Part of it is because we have had you. If you're the only minority and you are not used to that, especially that you know what you have to prove yourself to people. So how do you get over it is basically knowing your stuff. Now I don't know if you've ever heard this before. My parents are deceased, but I come from older parents. My mom and my dad are both deceased now, but they were old enough to be my grandparents when they had me. That back then, they just had me late. So I said all that to say that they come from a different generation, so they're gonna tell me exactly how it is back then. But they always gonna tell you or told me that minorities, black people specifically, have to know twice as much to do the same job as their counterparts. She would always tell me that. And if it's somebody who watches this who happens to be um, Caucasian or anything else, this is our history. This is what we're taught. So this is not meant to be offensive or anything like that. This is what we're taught, especially by the older generation. We're taught that in order for us to do whatever, we have to be twice as good, twice as smart, we have to do twice the work, twice the everything to do the exact same job. Yep, Miss Blackman, that's absolutely true. And I just had that conversation on TikTok too, where the worst thing about the imposter syndrome is that we know our stuff, but sometimes because we've been silenced for so long, we would continue to be quiet when we don't have to be. So how, as a student, how do you get past that? My thing is this: make sure you speak what you know. So, for instance, when you call or when you have a question in class and you happen to know this is the correct answer or whatever, don't be afraid to raise your hand and kind of you know speak what you know. When I call physicians or talk to people about things, like I'll in my videos, I'll say, okay, look, I don't have statistics. This is not research based. This is my opinion. I will state my opinion. But on the majority of the time, I try to come on here with research based facts, evidence. So when people want to argue me down about um, or people want to argue me down about what I'm saying, I'm like, go. The data speaks for itself. You just mad because somebody black telling you. And so once I owned that I knew what I was talking about, that I knew what I was doing, and that's another thing. I also owned when I made mistakes. So, Mr. Pay, own when you make mistakes, because we can move past it. Because the one thing they want to do is drag you through the mud, right? They want to drag you through the mud. So when you make a mistake, the first thing I do is say, you know what, I did make the mistake. Let's go ahead and work on me correcting it, and now let's move on. Because they will sit there and harp and harp and harp and harp about something Now, your counterparts that made the same mistake and they cry and then they're, oh, don't worry about it. It's okay. We all make mistakes. But you make the exact same mistake. They're going to drag you through the mud, have an in service about it, write you up, flag your little file, everything, because you did the same thing that somebody else did. So, nope. What we're going to do is I always, I own my mistakes. I said, what can we do to grow from this situation? And I said, okay, what is the policy on this? Let me look the policy up so I make sure I do it right the next time. I always document things. You may not say, what does that have to do with imposter syndrome? This has helped building my case for everything, because you will learn that, Mr. Pate, you have to build your case for everything. You have to have a paper trail for everything, meaning that you keep a track of every time somebody wrongs you or somebody, does something to you that's not favorable to you, but it's against the policy, but somebody else can do it. So again, to feel like you're supposed to be there, you need to basically be assertive. You need to know your stuff, own when you're wrong, correct when you're wrong, try your best to be a team player, and don't get ran over. And that's the biggest thing that you can do. Do not get ran over. Because what they'll do is they'll say, we know, can you do this, that, and the other? And what I've noticed too is if we don't agree to do something, we're not a team player. We're not a team player. But if they have to take the little Johnny to the soccer game, oh, okay, well, you know, you got to take little Johnny to the soccer game. I understand. It's okay. But if you just say no because no is a complete sentence, which is what I'm learning to do right now, me personally, I'm learning to say, okay, no is a complete sentence. I offer nobody no explanation. You need to know what I do, what I got to do. The answer is just no, and it's just no because it is, and that's okay. They won't take that from us. They won't take that from us. We have to offer explanations and everything. So you just need to make sure that when you learn your skill, when you learn your specialty, not skill, your specialty, you be the best person in that specialty that you can be. Own your mistakes. If you make a mistake, I messed up this time. Let me, try to minimize those mistakes, but own it. And then simply say, you know what, to yourself, I deserve to be here. This is self talk, just like they deserve to be here. Now, I may have to work a little bit harder for mine than they had to work for theirs, because let me tell you something. You're going to realize that you had to read that book front end, back end, and every which way. And you're going to have some students who somehow made A's on their test, but they didn't study. Yeah, you'll figure that out when you see how that works in school, and it also works in the workforce as well. You're right, Ms. Blackman. It is their mindset. You're right. It is their mindsets. You're right. But the thing is, because we have been conditioned, right? We've been conditioned otherwise, though. We've been conditioned otherwise. I will say this too, Mr. Pate. Speak your truth, because one thing I have learned too. Now I learned this on TikTok real quick. I was Someone wanted to proceed to tell me that I wasn't a doctor, right? I have a doctorate. I never said I was an MD. And we have a lot of people who are what's the word I'm looking for? They're uneducated as to what doctor really means. To some lay people, doctor means MD, and it doesn't mean that. It means that you have the highest degree in your field. And so when I said I was a doctor, they said, "Oh no, you're not a doctor." And the hate that I got from some racist people was expected. What I didn't expect was the people who say that I needed, the black people who are not supportive, but who continue to say, "Oh, don't even entertain those kind of people." This, that, and the other. Well, the thing is, that's what they don't realize. If I don't go for myself, who will? So they with that old slave narrative mentality that silence is what's best. I'm going to turn the other cheek. I'm going to ignore them. But if you go back to, if you've never watched, there's a movie called Antebellum that I think Janelle Monáe was in. If you've seen that movie, it's a pretty, within the past, 3 years movie. If you see the movie Antebellum, it gives you a good depiction of what slavery was like. And if you think about slavery, you think about the fact that when they were in those fields and if they were talking or made any sound, what would happen to them? So they have been conditioned to be silent. They learned to sing songs or hum tunes to communicate with each other. So why is it still today in 2021 when someone says something offensive to me, I have to remain silent because I'm turning the other cheek? Not this nurse. I will not remain silent. That's the slave narrative. Silence only perpetuates the problem that we already have. Silence only simply says to them that, you know what? I got her to do what I needed her to do. She's been conditioned. She's been conditioned, and I'm not the one. I'm not the one to be conditioned. So I'm trying to move away from that narrative. So with that, it kind of falls into the whole imposter syndrome where I'm kind of like, you know what? Let me be who I am. I'm educated. I know I'm educated. I know I'm qualified to do the job, and I'm going to do exactly what I need to do when I need to do it. If I'm wrong, I will admit that I'm wrong, and I will move on from there. That's not the issue. So I think that's kind of how I dealt with that, and I've had to deal with that over the years. I did not come out like that as a nurse. I will say that I did not come out like that as a new nurse because I didn't know how this field was. I didn't even know how racism. I did not know there was so much racism in nursing, y'all. I did not know that. And the higher education I got, the more I learned how bad it is. I learned how bad it is. It's bad. The higher you go, the worse it is for us. And you just have to have such thick skin. You're like, you know what? No matter what, you're not gonna keep me down. They're okay with us. They're okay with us being LPNs. They are okay with us being LPNs. They're okay with us being even up to a 4-year RN. But they're not okay with us going beyond that because then we have power beyond that. Because now we up here diagnosing, treating. MPs do that. CRNAs putting people to sleep, waking them up. Midwives are delivering babies. We doing it all now. That they don't like that. You said, some nurses on your mistakes. Yep, that happened here. Nurse Ultron. That happened here. I'm in Tennessee. I'm right. I'm like 30 minutes from that university. And I always tell my new nurses, you all sit there thinking that that these hospitals gonna back you. That hospital settled out of court in that situation. And actually, the hospital tried to cover it up. So Vanderbilt is not an Ivy League school, but it is a private school that the name Vanderbilt holds. It holds. Oh no, excuse me. It holds status here and everywhere because it's Vanderbilt. And that happened here and it came out in 2018. They covered it up. Is what the hospital did. And then when they got audited, that's when the whole thing came out in 2018. What had happened? As a result of that situation, every hospital around here had to undergo training about sound like lookalikes, the scanning process, how to scan medications and things like that, not to overlook all the things that keeps the patient and ourselves safe, all those things. But know when to be assertive on mistakes, and you don't have to share everything you know. Right, observe. Good point. Know when to be assertive. Also, assertive does not mean rude. Sometimes your counterpart thinks that when you're assertive, that means that you're being rude or disrespectful. That's not true. I'm directing to the point, but can be polite and professional at the same time. So don't know when it's your fight to fight. Know when you need to be involved and when you don't. And to be honest with you, Mr. Pate, when you are a minority in a majority situation, you just need to sit back and observe more than you talk. Sit back and observe more than you talk. Don't I'm not saying don't have any friends. You'll find people that you can gel with and you're cool with, and it's pretty fine. You're fine. But what I've learned is when you start getting in cahoots with certain people, you think that you're your friend until you tell them something. If you want to test it, tell them something and see how quick it come back to you. Tell them something. Say, hey, look, don't tell nobody else this. I trust you. Yada yada yada. See how fast it comes back to you. I've did that before. It don't be nothing. It don't be nothing like serious. But I've just tested the waters one time. I did it a few times really. I said, let me see if it's gonna come back to me. And sure enough, the story came right back to me. So the very person that I trusted not to tell the story came back, and people said, "Oh, are you okay?" And I'm like, "Well, who told you?" Oh no, no, nothing like that. I just saw that you looked dead. No, you ain't saying nothing. Somebody's been talking. You can't trust